Good morning, everybody. We'll get started in just a couple minutes. Okay, good morning, everybody. Thanks for joining us today for, oh, you know what? I'm sorry. Hold on just 1 minute. I think I'm actually sharing the wrong PowerPoint here. It's for the wrong group. Give me just one moment to stop sharing and I'll come back on with the correct PowerPoint. Okay, sorry about that, everybody. I had a meeting with our consultation service providers earlier this week, and I accidentally pulled up the PowerPoint for that meeting rather than this meeting. So thanks for your patience while I switch that out. So thanks for joining us today for our lead agency office hours. We do not have a topic of the month for this particular meeting. Instead, we're going to leave some extra time at the end for an open Q&A session. I know we've ran out of time the last couple months with the number of questions that lead agency staff have had, so we wanted to leave a little extra time for that today. But we will give a few updates. Our consultation services RFP update, provide some transition data. We'll give an update regarding our temporary approval, reminder regarding the 6893W. Talk about a little bit about a consultation services line on the service agreement, and then provide an update on if support plan signatures are needed, as well as some information regarding UMPI numbers on the service delivery plan, and then just share our training and resources guide. So our quick reminder to everybody, which we say at most of our meetings, is that if you are going to write something in the Q&A, just make sure that you're keeping that information confidential. So don't include any specific names or organization names in the chat. And then if you can just ask questions related to each slide that we're presenting, and I'll pause to look at the Q&A, and then we'll open it up at the end to any other topics that you guys would like to discuss. So we'll start by sharing some transition data. If you've been in other meetings with us over the last couple weeks, you may have seen this data, but I wanted to make sure that I shared it with this group as well. So we have, this is information sharing how many individuals have made the transition from PCA and CSG over to CFSS. So you can see here on the left-hand side of the screen, we have this larger black box, and we have about almost 55,000 individuals who are transitioning from PCA and CSG to CFSS. This next box here is about 9,000 individuals who are receiving services from a managed care organization. Okay, and then we have about 12,700 individuals who have not made any transition at all. So that just means they're still using the PCA program or CSG, and they do not have a line for consultation services or a line for CFSS on their service agreement. So we are working to contact all of those individuals to ensure that they know that they need to make that transition over to CFSS by September 30th of 2026. Then we have about 18,300 individuals who are currently receiving PCA or CSG, but they have a line on their service agreement for consultation services. So that's about 18,000 people who are working with their consultation service provider to develop a service delivery plan. And then we have almost 15,000 people who have fully transitioned over to CFSS. So meaning that they have a personal care line on their CFSS service agreement, and they're no longer using PCA or CSG. So if we look at the total of these two boxes added together, that's over 50% of our individuals have made the transition or are beginning the transition process over to CFSS. Okay, so we have what we're calling CFSS navigators, or we have 9 individuals within DHS that are contacting everybody who's currently on the PCA program. And they're calling them by phone and sending an email. And I believe that we're sending a letter as well, just letting them know that they have that end date of September 30th that they need to transition over. And then when we call them by phone and by email, that's an opportunity for them to ask us questions, get some clarification on the transition process if they need to talk to somebody here at DHS. So you may receive phone calls, or if anyone contacts you to say, hey, DHS is calling me, what is this new program, or why do I need to change, or maybe they think it's a spam phone call or email, you can assure them that it actually is somebody from DHS contacting them to walk them through the process. So we're hoping that everybody can get that phone call and understand the process a little bit more. So our CFSS navigators have already contacted everybody on the alternative care program. They started with that group because they need to make their transition sooner. So that deadline for people on the alternative care program is March 31st of 2026. So we contacted all those individuals already, and now we've moved on to everybody else who has to make that transition by the end of September. So I'm going to pause there and see if there's anything in the Q&A.
Erin, it's Janine.
Yeah.
So I answered the question. The question was, if there's a line for consultation, does that include a no pay code? And it does not. This is the blue box includes people with approved service agreements with an approved provider, or encounter claims that are coming in for consultation services directly.
Great, thank you. Janine, do you have anything else that you wanted to add regarding the MCO box here and these numbers with the MCO?
So sure, I think that the MCO gray box is very much like the red box. So the almost 9,000 and the almost 13,000 people in those two first boxes are virtually the same. We don't, because MCOs use their own systems. We don't have a service agreement in MMIS to check against, so we are using encounter claims for that. So that population, the gray box, is the number of people who um, are getting PCA or eligible for CFSS, and we haven't gotten an encounter claim for consultation services yet. The red box is what we're looking in MMIS for on the fee-for-service side. So just to be clear, those two boxes are essentially the same kind of people. We just have to look at them differently because we have MMIS for one and we don't have MMIS for the other.
Thank you.
Mm-hmm.
Okay, our next slide is regarding the data of how many people have chosen the agency model versus the budget model when they've already made that transition over to CFSS. So you can see here, we have 11,441 people who have chosen the agency model, and we have 3,508 people who have chosen the budget model. So we did anticipate that the agency model would have these higher numbers. And I think over time, we might see those even out a little bit more, but the majority of people transitioning over to CFSS are coming from the PCA program, and that falls in line more with the agency model. I think once people get more comfortable with the CFSS in the future, we might see some of those individuals transition over to the budget model. But this is where we are today, and this kind of falls in line with what we were thinking most people would be choosing at this time. So the next topic I wanted to talk about was the temporary approval. So we've talked about this a few times over the last couple months, and we did make one change to the temporary approval process. So if you recall, we had individuals who were being reassessed for CFSS for the first time around October 1st. And if they had an on-time reassessment, but they were not able to work with their consultation service provider to develop a plan and get that plan approved, they were having a gap in service. And so we had put a temporary approval process in place. So we had created the form number 6893L, or that temporary approval form, where the lead agency could approve the services that were being used the previous year, and the person could continue CFSS without a gap, and while they worked with their consultation service provider to develop the plan. And so the guidance that we had given until today is that was only for people who had an on-time reassessment. If somebody had a late reassessment, they would need to develop a plan. Okay. So today we're changing that guidance. Actually, it went out in an e-list on Tuesday of this week. But we're changing that guidance to say that if somebody has a late reassessment, but it occurs within 30 days after the end of the service agreement, the lead agency can use a temporary approval based on the date of their reassessment. Okay, so in other words, to give an example, if somebody was service agreement ended on November 30th, and they were due to start a new service plan year with CFSS on December 1st, but they did not have their reassessment until today, December 18th. There would be a gap between December 1st and December 18th, but the lead agency could use that temporary approval beginning December 18th through the end of the span year. And the person can work with their consultation service provider to develop that new plan, or that 6893P, before the end of the year. So they could continue with that temporary approval, but that temporary approval start date is the date of their reassessment, as long as it occurs within 30 days or less after the existing service agreement. Okay, so lead agencies need to continue to complete the 6893L, or that's the temporary approval form. And again, using the date of the reassessment as the start date. So hopefully that's good news to you. I know we received a lot of feedback from everybody that they were worried about individuals who had that late reassessment, that they were then just going to have a gap until they could develop that plan. So hopefully this will help with that process. Okay, so I'm going to pause for a minute to see if people want to put anything in the chat. Okay, all right. We'll go on to the next topic. So this is just a reminder regarding the 6893W. We shared this slide at our meeting last month, but I'm still getting feedback from our consultation, from our provider agencies and FMS providers that they are not receiving the 6893W. So I just wanted to reiterate with everybody at this meeting that the 6893W is required. MCOs can use an alternative form to the 6893W if they'd like to, but they do have to have some sort of alternative form. Okay, so the 6893W needs to accompany all service delivery plans. So the person and the consultation service provider will develop their service delivery plan, or that 6893P. And on the 6893P, there is no place for the lead agency to sign that document. So there's no signature field for the lead agency. So the lead agency instead is going to review that service delivery plan, and then they're going to complete the 6893W, authorizing the services. So they are going to use the correct units or dollars based on the date they approved the service delivery plan. Okay. Then they're going to list those services that are approved, and they're going to sign the 6893W. And then you'll be sending a copy of the 6893W and the service delivery plan, or that 6893P, to both the person and their provider. So that needs to go to the FMS provider, or it needs to go to the CFSS agency provider. Okay, so this is not a new process. We put this in place back in December of 2024. And we just need to make sure that everybody is following this process. The consultation service provider does not need to go back and change the service delivery plan to match the 6893W. That the purpose of the 6893W is for you as the lead agency to document the correct units and dollars, as well as the start date. Okay, and then that's going to accompany the 6893P. Okay, so I'm going to pause there and just take a look at the Q&A real quick. Okay, yep. So there's a comment here saying, can we clarify with the FMS providers that MCOs have their own form and they might not be using the 6893W? So yes, we will absolutely do that. We're meeting with the FMS providers tomorrow, and so I'll provide that clarification. That is also in our policy manual. If for some reason you need to refer to something, you can certainly do that. That's on the plan approval page in our CFSS policy manual. But yes, we can absolutely do that. So like I said, MCOs, they can use an alternative form if they'd like to the 6893W, or they can use that DHS form if they'd like. This question, does the consultation provider or FMS provider need to sign? I'm thinking that's the MnChoice's support plan. No, they do not actually have a slide about that, and we're to cover that in just a couple minutes. Okay, we'll go on to the next topic is adding a T10 or 1023 line or a consultation services line to the service agreement. So we've heard from a number of our consultation service providers that they don't have a service agreement to continue working with somebody. So this is just a reminder to everybody that we have to make sure that that consultation services line is authorized on every CFSS service agreement. Okay, so while we've said many, many times in the past that CFSS cannot begin until the plan is approved, That is true for personal care or goods and services or PERS, et cetera. However, consultation needs to be approved or authorized on the service agreement in order for the consultation service provider to develop the service delivery plan. So that line cannot wait until the plan is approved, right? Because they need to have that line in order to work on the plan. So this is just a reminder that consultation services line should be authorized in all of these different scenarios. So when it's somebody who's new to CFSS or making that transition over to CFSS, for somebody who's been reassessed for CFSS, when somebody has a temporary approval, you'll want to make sure that they have that consultation services line so that consultation provider can work with the person to develop their plan so it's no longer a temporary approval, right? Anytime that you're still entering a PCA service agreement for somebody, and then also when someone has that 45-day emergency start to CFSS, the consultation needs to work with the person within those 45 days. Okay, so we've heard also that some lead agencies are telling the consultation service providers that they will not add extra units to a service agreement and they should just bill on either the previous service agreement or wait and do their billing on a future service agreement once that's entered. And consultation providers, or actually any provider, cannot do that. So they need to bill on the date that the services were rendered. So if they did work for a person today on December 18th, when they're billing, they need to enter in December 18th as the date that the services were provided. They can't enter in January 1st or a future date or a previous date. So they do have to have an active service agreement with a consultation services line so they're able to bill.
Erin,
Yeah.
there's a question in the Q&A if the lead agency was in error for a late reassessment for CFSS. The provider faxed the referral on time and there's an error in scheduling by the lead agency. Is there no backdating like there was with PCA? So that is a different process and that needs to come into SASD, our MMIS team, and then we will consider the request in relation to the exceptions that we are legally allowed to provide. So it's from what we're talking about right now, or even the temporary authorization, it's a different process.
This process. Yep.
Yeah.
So this is different than what's written in the Q&A right now regarding a late reassessment due to the lead agency error. So that would still go to SASD. This is just if somebody has a late reassessment, but it's occurring within 30 days. Okay, they can do the temporary approval.
Yep. Thank you.
Okay. Yep. Okay, I'll pause for just a second to see if there's any questions regarding consultation services. And I guess I'll just, I know we've talked about this before, but if a consultation service provider is requesting additional units, you can go ahead and add those in. Sometimes for state plan services, that comes to DHS. For waiver, that would go to you as a lead agency. You can add additional consultation services units.
So Erin, there's a question in chat. If we go out for a reassessment, wouldn't the consultation services provider have enough units in the current service agreement that they could use to create the new plan?
So sometimes they might. Lead agencies are entering 6 units for consultation services in the first year. Because CFSS is new, individuals have had a lot of questions for their consultation service providers, and they've had to develop that plan and maybe go back and forth several times with the person or the lead agency. So they might have used all of those 6 units and they might be requesting an additional 6 units from you, or maybe even after that, they might be requesting 6 more units. So 6 units or 12 or 18, and that's okay for you to add 6 additional units. So you're adding them in increments of 6 units. And there's many reasons why consultation service providers may have had to bill all of the original 6 units. So if you're going out to do a reassessment, there may not be units left to create that next service delivery plan. So if they're requesting additional units, you can go ahead and add those.
I think the other thing, this is Janine again, sorry, Erin. I think the other thing just to consider is because CFSS is a new program with new services and new people involved and all of that stuff. We expected that the first year of CFSS would be a period of time where probably more consultation would be used than as we go along, as people know the service and they know what a service delivery plan looks like and all of those kinds of things. So I will say we're being generous when we're authorizing more units because in many cases, consultation providers are getting lots of phone calls from people and questions and all of those kinds of things. So we are allowing for additional consultation units to be authorized, which is very important um, for a consultation to be able to finish the job that they're doing and to answer questions and to be available. There should be some units that are left over towards the end of the service agreement so they can do some of that prep with the person to get ahead of to get ahead of time a little bit so there isn't a gap if possible.
Thank you. I see another question in the chat that's asking us to talk about consultation service provide or consultation occurring if a person's in a nursing facility. So we actually just talked about this with our providers on when we met with them on Tuesday of this week. So consultation services can occur when a person's in a nursing facility if that person is trying to make that transition home or to move out of the nursing facility. So consultation providers can work with the person to help them develop their service delivery plan so they can be discharged from the nursing facility and move back home. What cannot happen is consultation can't happen when a person's in a hospital. And so that situation, if you are working with someone who is in a hospital and needs the service of CFSS, they would be better to utilize that 45-day temporary start or the 45-day emergency start. So they would start with the agency model for those 45 days, and then they would have 45 days to work with a consultation service provider to get the service delivery plan developed and approved so they could continue with CFSS on day 46. So we did remind our consultation service providers that when they get that phone call, someone stating that they have that emergency or that 45-day temporary start, that they should try to prioritize those individuals to develop their service delivery plan.
So Erin, it's Janine again. There's a question about changing consultation services from one provider to another. It's a type B service agreement and the lead agency can still make changes in MMIS. Can we make that change? Yes, if you can make that change within that, if you're within the time frame to make the change, you can. Do both providers have 6 units of consultation? Old provider had billed already. Yes. It's not like all the work that the old provider goes to the new provider, and so you would actually add a line item for 6 units of consultation for the new provider. There's one other thing in the chat. Oh, can consultation providers request more units using a 6893K? Sometimes if the lead agency adds, there's an edit. I haven't had to do one in a while, but isn't it faster for them to request using the K?
I mean, I don't know that I would say it's faster. I think that if somebody has a case manager, consultation providers are supposed to request that from additional units from the case manager rather than submitting the K. There's a question if someone's in a hospital, but they've had a min choices assessment. they're not eligible for the 45-day emergency start. So that's correct. If they've had an in-person assessment, they would not be eligible for that 45-day emergency start.
And just a reminder about the emergency start, that people really need to have their agency picked out and their workers all ready to go, because if they're just looking for an agency and looking for workers, they will likely spend their entire 45-day emergency start looking and not getting services. So the unique thing about a 45-day emergency start is that they have to have everything lined up so they can actually get services.
Oh, thank you for clarifying. So the person said that their question regarding the adding additional units for consultation is for a type B service agreement. So state plan, yes, they would then use the 6893K. That is what they should be doing. Okay, I'm gonna go on to the next slide. Okay, yep. So regarding min choices, so we've received some feedback from different providers that mainly consultation service providers, that sometimes the contact information is not correct. And so what's happening is they are getting a service agreement that they're supposed to begin working with somebody, and then they go into min choices to get the person's contact information so they can call and set up that initial intake meeting. But the contact information is not correct in min choices. And so what happens is they cannot begin services because they can't get a hold of the person. So if you could just pass along within your lead agency to have them double check the contact information and make sure that it's correct. So address, phone number, email address. Okay. And then another quick update regarding min choices is that at this time, consultation service providers do not need to sign. Oh, I'm sorry. I put the 6893P. I meant to say consultation service providers do not need to sign the min choices support plan. Okay, so I'll make that change before we publish this slide deck for everybody. But they are not responsible for signing the min choices support plan. So we understand that there was maybe some misinformation that was given. We're trying to get clarification here within DHS, but at this time, consultation service providers do not need to sign that min choices support plan. Okay. The next piece of information is regarding the MPI or the UMPI number for providers. So we have directed consultation service providers not to enter UMPI on the service delivery plan that starts with the letter A or the letter M. So that is the UMPI number for the providers, and that's considered private data, and that information cannot be sent out to the person, the lead agency, or any other party. So if you receive service delivery plans without that information on there, know that that is intentional. We have actually removed that field from the service delivery plan going forward. But if you're getting some, currently that where that information is missing, that is intentional. And so you'll just need to go in and look up what that provider's number is when you're entering that service agreement. Great, I see something in the chat. Oh, thank you. Someone just pointed out that if someone's information changes, their contact information changes like mid-year, that wouldn't be updated in min choices. So thank you for stating that. Okay, we'll leave the rest of the time here open for you to ask any questions that you'd like in the Q&A regarding anything that we've talked about today or any other topics. So feel free, we'll wait a minute or two and then start answering questions. So I see the first question is that if the UMPI field is removed, if we can have the consultation provider's address and phone number. Or I'm sorry, if the consultation provider can add the provider's address and phone number, since some of them have similar names. So I just pulled up the service delivery plan. Hopefully you can see that on my screen. I believe that information is in there, but I'm just going to double check here. So let's just say if they're using the agency model. So they should be completing this whole field here for the agency model with the agency name, phone number, address, email address. If that's not on there, you could make sure that you're clarifying with the consultation provider that that's completed going forward, and then you could fill that in yourself if needed. And the same with the budget model. The FMS information is here as well. Janine or Meredith, do you want to answer anything or talk anything about the increase that's happening on January 1st? It looks like the question is, have you been able to touch anything? Maybe you want to provide some clarification on what you mean by touching anything. The LTSS rate sheet has been updated to reflect the new rate increases, and I believe MMIS has been updated, but Janine or Meredith, do you have anything you want to add?
No, I think we're kind of on the periphery a little bit. I think there's some language clarifications that might be posted for waivers, I think it is, that had some lines that we didn't anticipate needed to be split, but maybe needs to be split. So there's not us working on that. Otherwise, yeah, otherwise I don't know that we have any good information about COLA in general, other than what's been published and sent out.
Okay, thank you. I'm seeing a question asking about the e-list that and where you can find those e-lists. So I'm going to put a response to that question in the chat with a link, but I'll also just share my page here. So all of the e-list announcements are published. So if we just scroll down and click on 2025, these are all the e-lists that we've posted in 2025. So here is the one regarding CFSS that went out this Tuesday, okay? Or if you wanted to see any of the previous ones from the year, these are all the e-lists that we've sent out through DSD. And then I put a link in the chat for you as well. So there's a question regarding the budget model and if the budget model is prorated, if it starts, if it's not a full year. So yes, it is. It's based on the number of units that a person is eligible for per day times the number of days. And then that's just converted into dollars. So yes, that is prorated. Question, when can we expect new consultation service providers to be available? So that's a good question. I can give just kind of a brief overview of where we're at. So we had roughly 130 organizations express interest and submit a proposal to the RFP that was due at the end of August. We reviewed all those proposals in September and October and then notified those providers who had submitted a successful proposal in mid-November. Since then, we've been working with those about 30 providers to receive some financial information and some other information that we needed to collect from those providers. And we're in the process of reviewing all of that right now. That's called a pre-award risk assessment. So we're doing that piece. That's the next step of the process. And then those providers would be notified if they pass that review. And then we would then be sending them a copy of the contract. And then if they agree with the contract, they would sign, and then technically they would be enrolled then to become a consultation service provider. But then at that time, we need to do a lot of training to get them up and running and kind of at the same spot that our current consultation service providers are in. So that might take a few months. So we're looking at, we don't have an exact date, but we'd probably work with them through their contract in January and then begin the training process after that. Okay, so that kind of gives you a little bit of a timeline, although we don't have any exact date set yet. It will all depend on how long that training takes. Likely, the different providers are all kind of going to be at different levels of understanding. And so it might take some longer to get through the training, and others might be able to start more quickly. So we'll certainly let people know as providers are ready to begin providing services. Okay, so I'm seeing a lot of questions regarding the January rate changes and if lead agencies need to do anything. I don't have the instructions pulled up in front of me, although I might be able to take a minute or two to look for those instructions. But I believe the E-list was that the Type B service agreements, DHS is updating. For waiver service agreements, the lead agencies are updating with those rate changes as of January 1st. And we did have an E-list go out about that. So I'm just looking here on my other screen to see if I can find that and then share that with everybody. Janine, do you have anything more you want to say about that? And I do see that there's a question regarding the worker training and development. Do you want to give an update on that?
I have to research that. I don't know it off the top of my head unless Meredith does.
I'll just say the worker training and development, we are made aware of the issue, and that is something that we're currently working on at DHS, so we might just have to get back to you on that piece. Okay, and if I can find a copy of the E-list regarding the rate changes and what's required of the lead agency before we're done here, I'll put a copy of that link in the chat. Otherwise, I would encourage you to go look at the E-list because that information has been provided. There's a question regarding the tiered rates for the budget model, and if DHS is going to be publishing any information regarding that. I don't know if we're going to be publishing information. We're actually meeting with some of our FMS providers tomorrow. We'll continue to talk about that, and we're still in the process of working through what those tiered rates will look like for the budget model. And I think once everything is finalized, we can provide some more information or better be in a better spot to answer that question. So I apologize for the silence. We're just reading through some of the questions on our end. So bear with me while we continue to read through these. Okay, some of these questions I can see someone has offered a reply in writing, so thank you for doing that. Okay,
So,
go ahead.
this is Janine. I'll just say that anything on the rate sheets that should be changed or updated, it's not us that does that, it's somebody else. So we'll send that information to that group, and they would be responsible um, for actually making those updates.
So there's a lot of questions about worker training and development. So I'll just say we don't have an answer for you today, but that's not really done through our policy group as far as splitting the lines for worker training and development. But I do see there are a number of questions regarding that, and I will ensure that these questions get passed along, and then I believe something would be published regarding the update with worker training and development.
Yeah, I think there are people working on various pieces, but we'll share the questions that come through with them.
Okay, I see a question about future lead agency office hours. Yes, those are scheduled. I'm going to share that but when we're done here. I have a slide with the future office hours and a link to register. So I'm looking to see, or if anyone has any questions that are non-worker training and development, or not about the rate increase on January 1, because that is actually done outside of our CFSS policy team. So if there are any other questions, feel free to put those in the chat. Okay, I see a comment that we should ask our consultation service providers to make sure they have the correct location, since a lot of organizations have more than one location. So we'll make sure we pass that along.
Did we look at the question about the service delivery plan and somebody moving to an MCO in the middle of that?
Maybe, do you want to read that question and answer?
So I apologize if you've covered this in a previous session, but can you go over what we're supposed to do when a service delivery plan comes back and the client over age 65 has moved to a health plan? The original assessor won't be able to enter a service agreement, so who is required to approve the plan? I think I don't know that we have any special needs purchasing people with us today, but you'd have to talk with the managed care entity to transfer things over to them, because they would be the person that's doing the authorization at this point because it's on an MCO.
Janine, do we know if support plans have to be updated to match the January 1st rate increase? Does the support plan need to be changed as well?
So I'm assuming support plan means min choices. I do not believe so.
Okay. And I'll also just add that the service delivery plan is not going to be changed too. So you do not need to ask consultation service providers to update the support plan. Or I'm sorry, the service delivery plan. So, or if an FMS provider contacts you and says that they need an updated CFSS service delivery plan, they do not need that. So the service agreement is going to be updated and they can just make those changes within their system. We're not going to ask consultation to revise every service delivery plan.
Yeah. And for type B service agreements, they pay from like the rate record in MMIS. And so just for your information, providers should bill the new rates no matter when they had a service agreement sent out, because it'll pay from the rate file. And if they bill for something less, they might not get the additional COLA. So just for your information.
Um, I'm going to look up the I'm going to look up the rate sheet for worker training and development. And we understand that this is a couple things were missed. So just bear with me here
I
until
have it open. What is the question?
Okay. So I think so the question is right now is that it says that a CFSS policy team member advised us not to use worker training with the classroom, but there isn't a procedure code without classroom right now. So I'm sharing my screen for budget model. You're right. This is the UBUD that is for worker training and development with the classes. And so we are working on updating this rate sheet. So we do know that the other worker training and development was missed here with the budget model. Again, that's not really
No.
team. Okay, go ahead.
So, I guess I wasn't hearing that people were asking about that. So the reason why there is only in the budget model the classroom stuff is because there isn't a supervising professional to do any training. So there's not any supervision or oversight by supervising professionals. So the only kind of um, worker training and development is more of a classroom thing. Not that it has to be in a classroom, but we can't pay anybody to supervise or train the employees that way. It needs to be a classroom, which is why we only offer that one, because in a budget there is no professional who can train and delegate. That only happens in the agency model.
Thank you. Yep. So
Yep,
for budget model, we would only have that. And then for the agency model, we have the two. So the
correct,
U9 and
correct,
the U9UD for
correct.
classroom.
Yep. So if somebody gave someone direction to not include the UD for the classroom portion, for budget model, that wouldn't be true. That's the only thing that can be authorized, if that helps.
Thank you. So the question is then how is the lead agency supposed to know which worker training and development to pick for the agency model? So on the service delivery plan, there is a section where they're supposed to list the classes if they are sending their workers to a class. And so you would know by looking at the service delivery plan when you're reviewing that for approval.
And Erin, if do you have that page back up? Or
Sure.
could you get the
The
page
rate sheet?
back?
Yeah, here we go. Oops,
So
sorry.
if you look at the agency one, so S5116U9 and U9UD, there's an asterisk by the UD one saying that that's a billing code only. You authorize the U9.
Thank you.
Yep.
We are aware that there is this $2 difference, and that is going to be corrected. That was just a error. So we are aware of that. I think someone had put that earlier in the chat as well. Okay, so the question is, most of the time the worker training and development section is left blank. So in that case, which code do we use for the agency model? So like Janine said, you're just going to use the U9. There we go. The U9, and then if the provider agency is sending a person to a class, they would be using that UD modifier when they're billing. Okay, and that section is left blank for the agency model because the agency provider is completing that worker training and development section.
And the asterisk is on the top of the page, as you can see at the top of the page of 71. These services are not prior authorized and are only billed on claims. So anything in this rate sheet that has an asterisk in CFSS is billed on claims not authorized.
Okay, I'm gonna wait just one more minute to see if any other questions come through. So I will say we do track the questions that are being asked. And so for those of you who ask questions about worker training and development or ask some questions about the rate changes, we'll make sure that we bring those back to our group here. So I apologize that we are not answering those today, or if it appears that we're ignoring those questions, we're certainly not. It's just done through a different group here at DHS. Okay, so to go on, we have future office hours for lead agencies scheduled through June. So they're going to be Thursdays at the same time from 10 to 11 on January 15th, February 19th, March 19th, April 16th, May 14th, and June 18th. And so we have a link to register in this PowerPoint. This PowerPoint will be published on our DSD Training Archives page. So you'll be able to click on the link there to register for future office hours in 2026. And then, like we've reviewed at all the previous meetings, these are some good resources if you want to look up your own answers to any questions that you might have, or just need a review of anything. Feel free to look at these different resources available, as well as any training. So we want to make sure that all lead agency staff have taken these courses, the CFSS lead agency training, as well as the MMIS training for CFSS. Okay. And if you have any additional questions, you can certainly email us at dhs.cfss@state.mn.us. So thank you, everybody, for attending. We're done just 1 minute early, but we appreciate your time, and we'll see you back here in January.
Thanks, everyone.